Folks, welcome back to another episode of the I Am GPH podcast. Today we have two stellar students that are going to talk to you about the world of study abroad. They took a course called the Cool Course, and it has nothing to do with climate change. It's actually just a cool course that they're going to tell you all about. Today we have Bethel Abraham and Sona Fall. They were a part of a study abroad course in Tanzania that solved a deep issue in the community. And this program, which they went to, was looking for solutions by understanding the community issues to develop low-cost strategies by solving waterborne diseases, flooding, and controlling waste management. I don't want to go too deep into that in the intro because they're going to share their amazing journeys and what the course was all about. Bethel and Sona, welcome to the IMGPH podcast.
Thank you for having us.
Thank you for having us.
I want to know all about this cool course thing, but before we get there, would love to hear about your individual public health journeys. We were just chatting a little bit when the cameras were off as to how you all got here, but would like to get a quick summary. Where have you come from? What was your public health journey like? How did it begin that got you to this point right now?
I got introduced to public health actually while I was in undergrad. So I got my undergrad in public health at the University of Albany, SUNY. And initially going into my academic college career, I was very gung-ho, bio, pre-med, I'm probably going to go to medical school. And I kind of got into it and I absolutely hated it. So, one day I was like crying in my guidance counselor's office, Mary Kay, and she suggested that I pivot into public health. And I think I took my first intro to public health course I believe like the second term of my sophomore year. And I was like, this is what I was meant to do. Like I was meant to affect change in healthcare this way. I don't need to be an MD. I don't need to be like a medical professional to like make an impact in people's lives. And I kind of stuck with it. And after my undergrad time, I did a brief certificate in public health fundamentals and principles at University of Albany. Got into, working a 9-to-5 where I started off as a health educator. I'm actually still a health educator. And I realized that, hey, like if this is kind of the career path that I want for myself, it would only make sense to go in and get a master's degree and not necessarily pivot the work that I was doing, but like strengthen that and try to like broaden that.
This is a common occurrence I hear with so many students where I joined pre-med thinking it was public health. And I know we're going to open up that portal later on, but I feel like there's a lot of students that might be watching this. They're 18, 17, 16, and they think that they want to do something like public health. How would you differentiate what pre-med is and public health is?
I think for me, the reason why I was like, oh, I'm going to be pre-med was just my background growing up in an immigrant household, first generation, to go to college. To me, it always seemed like, okay, you want to like affect change in people's lives, you go to medical school, you become a doctor, and that's how you do that. And I quickly realized that, there are other ways to do that. You don't necessarily need to work in a clinic setting to, impact someone's life or change someone's health outcome that way. So public health to me was more so looking at a lot of the factors that contribute to, why there's, maternal mortality in the Bronx, or why there are, supply chain issues in the Middle East. All of those things, I think public health kind of helped map out a broader net of what impacting people's lives in terms of their health outcomes, their overall well-being, what that looked like. So that was kind of how I differentiated it for myself.
Seems more all-encompassing and higher level than specific. So you're solving at a larger scale than in the weeds type of thing, which both have their benefits, but for you, this resonated more.
Yes, and I think even with that, although I think oftentimes we look at everything in public health from like a wide scale perspective, there are still little pockets where you can get to like the nitty gritty of just community care or focusing on a specific demographic of people that have certain health challenges. So more so like just broadening the horizon of that impact that way.
I'm sure someone's definitely got a lot of value out of just hearing that, and it's normalized for them. I'm sure there's someone crying in their advisor's office right now.
Yeah.
What about you, Bethel?
I think my story has been so not linear, but like looking back, hindsight so 2020, and I was meant to be here today doing this podcast with you in Sona, and in public health. I think very similar. Growing up, I was born in Nairobi, Kenya, lived there for 7 years of my life, and I'm not sure who, but someone instilled this doctor name upon me, and that was something I carried up until my undergrad, actually until the end of my undergraduate degree. And I really had a heart for children, wanted to care for kids just like all over the world. That was just something that I wanted to do. The build out of that came with so many experiences along the way. And I ended up working at a children's hospital in Canada. I grew up in Canada. And in the emergency unit, I was doing some research in emergency department with children. And you just see, or I couldn't stop seeing a system behind children. A family system, a healthcare system, a political system. And it felt like it was impossible to support children in a health setting without impacting the system some way, shape, or form. And it was frustrating. And I think now I lean in towards frustration, and that instead of like running away from my frustration's a sign for me, to do something about it. And I'm meant to do something about it. So from there, I had a lot of support from mentors, ended up working in neuropsychiatry research, and then education, particularly for immigrants and refugees to Canada. And then from there, I traveled back to Eritrea. And there is where the common thread of public health was just like so clear, because there too I saw huge mental health gaps, and I was really there to travel and visit my family. Had no intention to do any kind of like professional work, but from what I saw, I couldn't ignore it. So I spoke to some of the professionals, which led me to the public health minister of Eritrea, and in that conversation it was just so apparent of what the gaps are, and how I could be an instrument. And it just showed me that I need to go back to school and pursue Masters of Public Health so that I can be a part of solutions. And that, led me back here to New York City and studying public health, and which has actually deepened a lot of interests that I had, but also broadened. And I see this public health field not just as a way to, advance population health, but really narrow the gap of equity globally.
My favorite thing you said is my frustration, I leaned into it. My frustration, it almost sounds like my frustration is my gift right now, that I can influence, that you're noticing patterns everywhere you go. And I like how you both have that common theme about where the mindset of public health, where it started and how it evolved for the two of you. I'm even though I'm so tempted to go deeper into your journeys, I think let's explore the whole idea of study abroad. What was it like to find out about this course? You both are students at NYU. I'm sure there are a lot of students that are looking for, I want to study abroad. I don't even know where to start. How did you both stumble upon this course? What was the whole process like to get into a course like this?
Like, I initially seen an email about it in the millions of emails that we get as GPH students. And I'm like, okay, they're doing study abroad again. I had initially wanted to study abroad the winter before that in London, and that didn't happen. Just a lot of scheduling and stuff that wasn't able to pull through with that. So I kind of like eyed it for a little bit, didn't really think too much about it. But I was in a class with the professor that actually kind of like spearheaded the initiative, Dr. Dickey. And he was speaking about it one day while we were in class. And I was just like, okay, I think everything that I'm like applying in the course at that class in time, I could use for this other course in Tanzania. And like, it would be a great opportunity, to travel somewhere I've never been before, and see what it actually looks like to work on the ground, right? Because I think a lot of us go into public health thinking like field work is great, we want to do field work, and a lot of us don't have those opportunities to do so. And I've never had the opportunity to do so. So I thought that it would be like a great addition to my learning experience outside of the traditional classroom or outside of the screen on Zoom. And I applied to the course. I connected it back to just like my personal story and my personal interest, being someone that is from West Africa. I'm first generation Senegalese American. And just trying to find like that bridge, trying to find that connection of like, okay, what exactly is it do I really want to do with this? So I applied, got accepted, was a little worried, like, oh my God, will I really be able to make it happen? Like, I work full time. So I was like, oh my God, I'm going to take off of work. And like, is this going to be possible? But, you know, there were a lot of resources available to me to kind of just make sure that it would be like a smooth process of being able to go. And I think that was kind of like the most challenging thing for me, just like the logistics of it. Because I knew that like once I got into the course and the course started, that like I was going to be in it.
What was this application process like?
It's a form. It is a Google form, actually. You know, name, concentration, why do you want to take the course? How do you think the course will benefit you? That type of thing. And I think for me, it being a course that was centered around climate change was something that was very not new to me, a little familiar, but something that I never really kind of gave a little bit more initiative into. Like a lot of my passion in public health is centered around like women's health, maternal health, child's health, just like Bethel. So I think like taking that approach of looking at the impacts of climate change was something that was very like new and intriguing. And I just kind of wanted to like just broaden my horizon in kind of the way in which we think about, you know, health outcomes in terms of like how all of these things are very interconnected, and like strengthening one aspect of that can have great effects to other
All
aspects.
around, yeah. What was your process like then?
We're both part of a lab called Applied Global Public Health Initiative here.
AGPHI?
AGPHI.
Do people call it different things?
It's
I've heard
AGPHI.
very different iterations.
Really?
I've heard AGPHI.
Yeah.
I've heard, what did you just call it?
AGPHI?
AGPHI.
Yeah.
AGPHI.
All right, AGPHI. So you both are a part of that organization?
Correct. And Dr. Dickey is the PI and faculty mentor, and so mentioned it in the lab.
What's a PI?
A principal investigator. That's just typically for like a research lab, what we would call someone who's kind of like oversees the lab. But faculty mentor really is his official title. Yeah. And so in the lab, he shared this initiative, and I swear I wanted to just jump off my chair because I think I really wanted to center my work in East Africa. And I was like looking for just any opportunity. And it was really timely for me for the course and the travel, all that. And so when he said it, I was thinking about ways to make the connections and learn more about what it is the objective of the course truly was. Like Sona said, it was field work, and so I was like ready to get down and dirty and like be with people and talk and really learn more experientially than like this download of knowledge or transfer book theory. I just really wanted to learn with the people, of the people that I want to work with, right? So, and then the partners too really struck a chord with me. UNICEF has been an organization that I've wanted to work with since I was a kid, and so
that was a part of the study abroad program. It involved the collaborations and partnerships with other organizations.
Exactly. So we had a partnership with UNICEF Tanzania. Mm-hmm. We had a partnership with MUHAS, a local university. We also had partnerships with the government Ministry of Health in Tanzania. Uniquely too, I think this was the first study abroad class with multiple schools represented. So it wasn't just GPH students. Wow. There were other disciplines also represented. So very, very multidisciplinary in nature.
How exciting. I mean, it's not only organizations within the country and international organizations, but also different schools coming together. Yeah, I would be jumping too if I was at an AGPHI meeting finding out about this.
I think it just even made like the learning experience more well-rounded. For me specifically, just listening to different perspectives and how people thought about solutions to some of the common problems that arise. That was something that was like very, very meaningful to me in terms of like what I got out of the course. Just being able to work with professionals in, an organization like UNICEF that a lot of us aspire to work for one day, and just learning from them, hearing about what they do on a day-to-day, and connecting it back to like that fieldwork piece, and just seeing what they actually do and how they actually come up with the solutions that we learn about in the classrooms, and like those types of frameworks was very, very meaningful.
Why don't the two of you take me to arriving in Tanzania? First impressions, what was the program like? What surprised you? Would love to hear about the entire experience as you arrived into the country.
A lot of excitement. Tanzanians are like some of the most welcoming, warm, humble people I've ever like got to encounter. And yeah, landing in Dar es Salaam, Tanzania, you can like just feel the excitement in just like our cohort. The first day was like getting acquainted with our colleagues at UNICEF, with Muhas and all the faculty. So just like really relationship building. The second day, I think, is when the party got really started, and we were in the classroom, and all of us were just like excited. For me, what really like stood out is, we as students are here investing our time, of course, to take a class, and we really are wanting to learn. But it was that much more amazing to see like health communications management in Ministry of Health who are taking time off of their like, serious jobs to be here with us. And it wasn't like this hierarchy, but it was this, no, we are all wanting to learn together.
Wow.
We are all in this to really like understand and make a change in our country. And so for me, I'm like, if they are just as invested, I will give that much more. And so I would say like so much excitement, the wealth of knowledge and like wisdom in the room. I don't think I've ever been pushed to this extent in my academic career. And I'm an A student. I am like, someone who really loves learning. And so it was just amazing to be in a context where everyone wants to learn and, put that knowledge to motion.
For the record, the two of them asked me to introduce them as grade A students in the intro. I didn't do it, but it seems like they're going to do it for themselves today, which they are, and rightly so. It just shows that when you showed up over there, you didn't expect everyone to be so involved and invested in this mission. It felt like, it's just a program, it's just a class. But this felt like the real deal, and I'm actually getting the theory and the real life experience all in one package while being in a new country and actually solving a real problem. Seems like the ideal package.
For me, I had like a bit of deja vu when I got out of the airport. It was my first time in East Africa, and I've only traveled back home to Senegal like one time. But I got out of the airport and I was like, am I home? Because it just felt so warm. And I think I can echo what Bethel said in terms of just how amazing and welcoming people in Tanzania are. Great hospitality, and our cohort of NYU students, along with a lot of the people in UNICEF, Ministry of Health, everyone was just kind of ready. Everyone had like this initiative of like, oh my God, we're all here at the same time. Everyone has such a different perspective. Everyone has a different, world of knowledge. Like, let's use it. And something that always comes up in my mind in terms of just my work and my academic career is opportunity. So for me, I was like, this is an opportunity for me to actually, be about it kind of thing, not just I want to do this in the future, I want to be this type of person in the future. It was actually the time to say, hey, here's your chance. Take advantage of your chance. And I think we all took advantage. The amount of knowledge that we all gained within like a week and a half, it's still a little mind-boggling to me. I think a lot of us have sat and gone through a semester of coursework, and we get it. this is the objectives of the course, but I think to be in like a pressure environment like that, where everyone is kind of pushing everyone to put their best selves forward, is something that you can only get an experience in terms of those type of opportunities.
I have to ask about the day-to-day. So it seems like the best pressure cooker alive for people like you, where it seems like every day was, man, I'm so excited. Wow. That's kind of what I'm feeling in this room right now. I wish they could feel that on the video as well. What was a day-to-day like? How would you describe it to somebody? I woke up at 4 a.m. because I'm so excited. Have to hear about it.
Well, we were roommates.
Yeah, we were roommates.
So we didn't sleep at all.
Yeah, like we would stay up all night and talk about ideas. But I think we would wake up around like 6, 7 a.m. We would all have breakfast together. Everyone's like fueling up, like we have to hurry up. We only have like 10 or 15 minutes before we have to get on the bus. And, we would go into our classroom, and every day there's like a new presentation. Every day there's a new theme in terms of just like getting us to think a little bit deeper in terms of our strategies or our solutions. There was also a particular day where we kind of just dedicated that day to fieldwork, where we actually had the opportunity to go into like local communities, speak with local community health workers, and like get the ball rolling with that. So I think like every day around like 4 or 5 p.m., we would all just like sit on the bus, and like everyone would just like take a pause of like, because it was just so much knowledge that was being shared, so much that we were all absorbing.
Oh, so what was happening in the days? So you left. When you go on the bus, where are you going, and what is
so when we
get
on the bus, we would go to the Muhimbili campus, Muhas. There would be representatives from UNICEF, a lot of social behavioral change models. We focused on systems thinking and systems mapping. We focused on monitoring evaluation. We would also like break into our groups. So we were like placed into teams, and we would have a lot of opportunity to kind of just sit there and team build and talk about ideas and think about how we wanted to approach our projects and our presentations. And of course we would have lunch. They fed us. And the food was phenomenal. And then we would come back in, and we would just do a little bit more, team building or a little bit more teamwork, and just try to like get things head on and have like a head start in terms of like planning. And a lot of friendly competition, I could say, happened in the room. I think a lot of us that went into it were like, we're here to win. But I think towards the end, like the competition part and all of that was very, very important and very crucial. But I think just the learning experience of being able to share and foster knowledge with people was like the biggest prize.
The sessions in the classroom, they were made to think of our intervention from a different lens and then build upon it, right? And so half of our day at the campus would be spent with our groups, like Sona described. But the other half is like in a classroom. And we explained that this is like a week and a half, not even, of a time that we have. So such a short amount of time, but intense. And towards the end, a lot of us were getting frustrated with just learning. And if I'm kind of crazy to say, but, it's because we really thought we had like this end goal already, like completely done. Like we had our intervention, we developed it, we created it. Please don't touch it. Like it's perfect. But I think what a lot of us were pushed into is this like learning to unlearn, like unlearn and the things that you think you had 100%. Add another lens, test it. Okay, did it pass that test? Okay, go on.
Can you give me
else.
an example of when you experienced that? Like what was one moment that comes up for you? Oh, 5,000.
Many. Yeah. So we had like, maybe let me walk you through the days. So the Thursday we arrived, had our sessions together. Friday is when we were put into teams. Okay. So we were introduced with one another. We've never met one another, but in a week's time, we're going to be family. This is the expectation. Saturday, we go to the field. Before we went, we were tasked to kind of create systems map. And what a systems map is really putting outcomes. You have an outcome of interest, but then you look at the outcome and see what possible aspects, elements would influence it, whether that means, in a positive way or in a negative way, and then what influences that. And then kind of like categorically think about all the different systems that could really impact. So my team chose malaria cases. We had an epidemiologist that worked for the Ministry of Health. We had, an educator. Like it made sense to choose malaria cases and to reduce that in the region that we were going to. We thought we had a competitive advantage. And then we did take that systems map. We crafted some questions of, okay, what do we want to ask the community? Took those two things and we asked them. We started off the conversation of what does it mean for you to, be a community member in this specific community, and really got to hear the stories come out of like belonging and the heartache that comes from seeing children play in pooled water because, the infrastructure is not there. It's, informal settlements. So no paved roads, housing is, very, very deteriorated. And so they just explained what it means and feels like to be living there. And we also had community health workers that were working, in the community. And so really kind of voiced some of what they hear from the community. So really had this rich experience with the community. So we took the systems map, threw it out, and we said, okay, let's draw it together, and got them to really help us like see and, what is it that influences. And malaria was on there, but it was not on the outcome of interest. The outcome of interest was waste management. Going back to our theme of climate change and how it impacts. We saw with our own eyes the trenches that they dug up to for erosion not to kind of like take over the community. We saw and latrines in each household that are used for household waste being in the streets. So really people's lives are they're not living in dignity or health in any kind of way. And so you can see how these pressing issues for them trickles and impacts malaria, what we thought was the solution or what the main objective of our being there was, which it did impact, but not necessarily the main outcome. So that was Saturday. And we still have Sunday, Monday, Tuesday, Wednesday, Thursday, Friday. But we took that. I guess to answer your question, the first frustrating for me, because I like to get things right, is how did I not get it right the first time? And that ride back from the community back to our hotels, I was just in my thoughts thinking and processing everything that I heard the community say. And really, it was a framing for the rest of the time there that I had to. We talk about bias in public health and preconceived, notions, and really listening to the community. And it's not a passive process; it's such an active decisional process. You have to choose to do it. And so I quickly learned that that's something that I have to kind of press in a little bit and put away. Okay, what I think maybe the solution is, and not even to start thinking about the solution. Just listen, and it will come out. And they actually did give us 3 strategies.
How has this experience as a whole influenced how you go out into the world of public health now?
I think it's grounded it for me.
Wow.
Just like Bethel, like a lot of us literally went into this thinking, we did our search, we looked at the databases, we know like malaria is an issue. I think even just like a month or 2 before we flew into Tanzania, there was like a very big cholera outbreak. So in my mind, I'm like, we're definitely going to be focusing on cholera. We're definitely going to have to, figure out a way to strengthen the solutions around that, right? Just kind of like thinking ahead, trying to, put my best foot forward per se. And I think the fieldwork experience for me was very eye-opening. So we went into the Azimio Ward and our bus was not able to get into the ward because there was this huge puddle of like standstill water. It probably had rained maybe like a week or so before we had got there.
Oh, wow.
But the water was still there. So like in my mind and other people's minds, we're like, what's going on, right? And we get into the community and we just, we start speaking to community members just like Bethel and her team did. And we're there trying to do like a root cause analysis of like, when are they going to bring up cholera? When are they going to talk about malaria? And, the community members are just telling us, oh, we're not worried about that. Like, we know how to deal with that. We know what to do. We know how to prevent ourselves from that. But our biggest challenge, just like, Bethel's group found out, was waste management, right? We feel very abandoned by, the system that's supposed to be put in place to kind of help us. No one comes to pick up our waste. We have to dig latrines for ourselves. Our children are playing around, right by the waste bins, the trash cans, and, you walk through the community. You go to one house and you think that's just the only house that's going to talk about that, but you actively see it all around you. So I think for me, in terms of just how I want my career in public health to look in the future is just taking that step back of saying, if, you're trying to take the initiative or impart change in a specific community or a specific group of people, you have to kind of come in with the idea that you do not know anything, right? You might be the expert, you might have sat through the class and got your MPH, but you do not know anything, right? When you are actually actively speaking and actively engaging with communities, they know everything because that's their lives, that's their realities. All you're there to do is just kind of assist. So I think that was one of the biggest lessons for me, is that, not coming in as like, I have all the answers and, we're here to save the day, but like getting out of that decolonized mindset of thinking that you have all the solutions and all the answers just because you put in the time. But, people in any community, they know what they want. They know what they need, because at the end of the day, it's their lived experiences. Something that really tugged on me was that, we can sit here and make systems maps and figure out a solution to your waste management problem. But at the end of the day, we get on flights and come back to New York, So what can we do? How can we assist in kind of leaving tools here so that you all are able to go about your lives at the end of the day after we're out of this context? And that was kind of the biggest thing for me.
I'm going to ask one last question because we can keep going forever. I'm so excited to dive deep into it. But I'm most interested for the students that are considering studying abroad. Someone might be very excited, someone might be scared, someone might not even be considering it. So if you both had to leave incoming students, current students at NYU with something about study abroad, how would you present it to them?
We talk about like intercultural competencies or cultural competencies. It's one thing to really read about it, theorize it, write an essay about it, but it's completely a different ballgame to actually go and live it. And that just goes for any kind of principle theory that we learn in this field. The fieldwork study abroad experience will look very different, I think. Of course, I have a very huge bias for the Tanzania one, and if it's running again, I think it will be. Our partners are definitely for it. I will probably be there.
Same.
Yes.
We're finding a way.
We're finding ways to be there. I think as a student, you think like it's not possible. And a year ago, I probably didn't see myself doing all these experiences. You think about, all the resources you have to gather and like just really real talk here. And so for any student who feels like they cannot, I would say you can. And if you really like want to talk about like ways to get there, like shoot me a message and like I'm happy to be a resource. But also the professors. When I thought I wasn't able to get there, a professor looked at me like, why didn't you tell me? And don't take no as an answer. Like in anything, any part of your life, really don't take no for an answer. If you really feel like you're meant to do it, you will be able to do it. And so just like believe in yourself and go for it. But yeah, for the study abroad experiences, it's such a rich experience that you cannot get in a classroom here. Although, you know, our global experienced professors bring their wealth of knowledge, you're getting it secondhand. So be a first-hand learner. Like go and like learn for yourself and feel it. I think that's the one thing I took away. It's like no one can take this feeling away from me. I have this undeniable like feeling that I cannot undo and detach myself from. And I don't want to. I think it's going to ground everything that I do moving forward in the public health sphere. And the way you frame it. So you can do policy, but if you forget the people, then who are you really impacting? Who are you wanting to serve? And so I think for me, it's really reframed and like re-cemented that the principles of public health in a global setting.
I'm sure it's a massive plus one. Would you like to add anything to that?
I think the word that keeps coming up for me is just opportunity, right? I think if the opportunity is on the table, you should take it. A lot of the like logistical aspects of study abroad was something that I was very, hesitant with. But I could tell that if I didn't just put aside like, the logical thinking of like, am I going to have enough money? Can I take time off of work? Those things kind of hinder like the opportunity for you to like take advantage of something that's in front of you. And I think that was one thing that I don't regret about the experience. And I think just our class itself, like our instructors and our professors were kind of like championing us. And I think that, like it's just something that you really cannot explain to someone. Like you just have to be in it, right? It's kind of one of those things where it's just like, yes, it's great to hear about, your professor's time at UNICEF or WHO. Or, that time they were in Nigeria or Nairobi or wherever. But, like, until you're actually in that same place, there's, like, a wealth of knowledge that you gain from yourself through that experience that way.
You have to be there.
Just to add on to that, I think just moving forward, any other opportunity that does come up, like, I want to be the first one to take it. Because I think there's something that you gain out of that type of like pressure environment that's kind of just like pushing you to like think the way you don't normally think, that I think that in the field of public health we genuinely need. Is very easy to be like, the data says this, the experts say this, but to kind of like put yourself into, even if it's just for like a little moment, into the lives of the people that you're trying to work with, it brings something else out of you in terms of the way that you think, in terms of the way that you strategize, in terms of the way that you communicate.
I'm sure after hearing these answers, there's going to be numerous people also jumping on opportunities, thanks to how inspiring what the two of you had to share was today. I really, really admire hearing your journeys and where this is taking you in the future and how it's created a sort of foundation to everything you do in public health. It's almost like the two of you can't get enough of practical work while supporting the theory at the same time. We'll close here for today. Sona and Bethel, thanks so much for coming on the podcast, and we really, really loved hearing all your insights.
Thank you for having us.
Yeah, thank you.
Yeah.
Such a pleasure.
Absolutely.
We'll be back when we go to Tanzania again.
So round 2 of the Tanzania interview will be back if they do go back. And folks, that's a study abroad masterclass, at least from the Tanzania perspective. If you have any questions, please shoot in the comments below. We'll put Bethel and Sona stuff down there as well for you to reach out. And we'll see you in the next episode. Take care.